Lee Health is explaining some shocking numbers. Their hospitals are reaching capacity as COVID-19 numbers surge. During today's media briefing, the CEO said their operational bed capacity is now at 97%, but that could look different in coming weeks as employees return from extended leave. Fox 4's Rachel Lloyd explains.
Dr. Larry Antonucci says 97% of operational beds in use doesn't mean they only have 3% left. They just can't use all the beds in their hospitals given the limited staff they have right now. There's about 80% of their hospital beds being used in total, still unprecedented for this time of year.
For the first time in memory, we are experiencing a high volume of patients during the summer months due to the pandemic.
Dr. Antonucci told reporters over the phone today, Lee Health usually closes some units over the summer because the beds aren't needed. But now they're seeing 35% more patients than they normally do.
With that said, our current census is at 97.1% of operational bed capacity.
They can only use as many beds proportionate to how much staff they have working. Back in May, Lee Health offered employees take extended leave to cut operational costs as COVID numbers declined. And now they're activating the second part of that plan.
We are working our surge plan, including reducing elective surgeries and bringing in more staff to open additional beds.
Bed capacity is at 85%. 1/4 of those are 300 COVID-19 patients. The chief nursing officer for NCH in Collier County joined the media call to provide updates on their facilities.
Out of our 153 ventilators that we have on hand, 12 are being used today. 9 of those ventilators are for COVID-19 patients.
And 37% of Lee Health's ventilators are currently being used. Dr. Antonucci also reminded everyone to play their part in bringing those numbers down. Rachel Lloyd, Fox 4 in your corner.